You've heard a number of key comments today, certainly among them consideration of the work that we've done with Prepaid Health Care Act, our compact migrant situation, no dish, the rapidly aging population, and of course the unique challenges associated with our provision of health care to our Native Hawaiian population. And lastly, you've heard the term geographic isolation a bit. That's sort of a tick list of key points, but the one thing that I would like to reiterate to you, to add to that list, is the Hawaii definition of rural health, and it is different from any other state in our country. So often we have found that, and this is what I hope we can avoid in the approach of this bill, the salami slice, the across-the-board approach to rural health. And it simply is unique here and requires consideration in that regard, waiver. I'm talking predominantly, obviously, about the water aspects, but let me just give you one example. We had a key program fairly recently where our hospitals, and most of our hospitals are neighbor island hospitals, and we wanted to apply for this rural...
Tom, excuse me, can you say that quickly? Neighbor island, we know what we're talking about.
Thank you, Congressman. Thank you. Neighbor island, as in Oahu-centric here, the big island, not necessarily the biggest. Our neighbor islands surround us here, and we look out to reach out. When we say neighbor island, that's a Hawaii word almost for rural, you might say. Yes, indeed. But we found a major legislative program available to us if we could qualify for rural. The definition of rural was per capita, people per square mile. And when we chased that rabbit down the hole, lo and behold, indeed, we found that water didn't count. They just measured the miles and we didn't qualify. And it's that kind of thinking that needs to be considered here. Think of these islands, think of these hospitals. Our hospitals are on 5 different islands here in Hawaii, and the word divert comes to mind, because you will find anywhere in the other states of our great country, when a hospital's full or for some reason not fully able to offer its services, they go to divert. And the patients don't go here, they go there. And it doesn't work like that here. No matter what the case, you take all comers. There are no other real options often. And please, we do ask you, the uniqueness of our rural definition, please consider that as Medicare considerations, reimbursement considerations, the unique provision of health care. They all come back to that one thing. We're not geographically isolated alone. We are uniquely rural. Thank you so much.